Hello, everyone. So this is Hannah and Brandon. Today we are here to present on atrial blood pressure measuring and also monitoring and other things as well. So first of all, we're going to start with the definition of what we meant by hemodynamics monitoring. First of all, when we talk about hemodynamics, it's a continuous assessment of blood flow, pressure, and oxygen delivery within the cardiovascular system. So here we are looking at a patient who is in a critical state where we need to assess the blood pressure, but it cannot be monitored using the usual way. So we need to use the hemodynamics monitoring to assess it. Now, what is the importance of this? The importance is to provide critical information about a patient circulatory system. So as I said earlier, sometimes we have some of the patients, especially those in the ICU and the ER, it's very difficult for you to assess their blood pressure. So we need to use the atrial pressure monitoring to be able to assess it. And also it helps us to know what is going on in the patient's body when it comes to the circulatory system. The next is to make timely decision and overall patient care. And as you know, in ICU and ER is a critical place where the patients are all in critical condition. So as a professional nurse or doctor, it's very important for us to do this assessment and in order for us to make a timely decision to save the life of our patient. Next, we're going to talk about atrial blood pressure. What is it? Atrial blood pressure actually means a direct monitoring and also a continuous method that is used to measure the blood pressure of a patient through intra-atrial catheter. What we mean here is that we do not use the normal blood pressure cuff that we use to measure the patient blood pressure, but here we are going to do an invasive method where we use an intra-atrial catheter through the patient chest and into the heart to be able to measure the patient blood pressure. And this is very important for three main reasons. The first thing is one, intensive care unit patient to really require like vasoactive drugs. And these drugs, we need to monitor them continuously, the blood pressure of the patient. Next is patients who are critically ill, in patients such as those in septic shock, those who have cardiogenic shock, and also those who have multi-organ failure. So these patients are very crucial for us to be monitoring their blood pressure almost all the time. Next is patients who have unstable blood pressure. So for example, if a patient who has a severe hypertension or hypertension, it means that the blood pressure is not stable. So it's very, very crucial for us to use the intra-atrial catheter to be able to measure the patient blood pressure continuously. The next thing we'll look at is the comparison. So when we compare the intra-atrial catheter with the normal non-invasive blood pressure, which we call the NIBP, it's kind of the information that we get is intermittent cuff reading. For example, you just measure the next 2 hours, you measure using the cuff, but with the ABP is a continuous measurement where we continuously monitor the patient blood pressure, and it's also connected to the monitor on the patient bedside. So now we'll move on to the measurement, but before that, I would like to talk about the items that we need when it comes to the measurements. First of all, we need a sterilized gloves. We need atrial catheter, and these catheters are dependent on the patient size. So for example, we can use a 20G or 22G, depending on how the patient radial artery looks like. Next, we need a sterilized drape and towels. We also need sterilized gauze, and then we need depending on the protocol of the hospital, maybe we need a povidone iodine for the skin antiseptic to make sure that everything is sterilized. Next, we might need lidocaine, depending on the hospital protocol. We also need 1 ml syringe and also a fine gauze needle for the anesthesia injection procedure. Also, we need a scalpel, but the scalpel is sometimes dependent on the doctor who is going to perform the surgery, whether the doctor will need it or not. Next, we need a pressure bag, and the pressure bag has to be inflated for around 300 mmHg. We also need 500 ml of normal saline or heparin. This is to prevent coagulation in terms of the surgical procedure. Next, we need a transducer kit. We need transducer holders. We need transparent sterile dressing. We need sutures. We also need to label the atrial line. This is to help to prevent confusion with IV line, because the patient might have IV line, the patient might have the atrial line. So the next nurse or the next health professional taking care of this patient will be able to differentiate between the two. So labeling is very important in this situation. Also need bedside monitor to be able to monitor the waves that will be displayed on. And they will also need atrial blood sampling syringe, and it has to be heparinized. Important because to prevent coagulation. Last, we will need a cap or maybe a dead end hub for stopping backflow, black flow in the sense that when the blood doesn't flow back in terms of the measurement, which I think Brandon will talk more about that. So I'm gonna hand over to Brandon to continue.
Okay, so thanks so much, Hannah. So after all of that, learning about how the item we need is, so next we're gonna come to the measurement method. So before we gonna try to understand how the procedure work, we need to figure out what is the basic component that related to the ABP monitoring. So intrinsically, the monitoring consists of three parts. The first one is the measuring apparatus. Sounds very fancy, right? So it basically just a tubing system that in one line is connected to the person artery, and also the another end connected to the transducer. The tubing system is also established with a flushing system, as Hannah mentioned, in a way that to prevent there's no blood flow that enter the system during the performance. So the flushing system also consisted of 500 milliliters of pressurized saline or heparin saline to prevent coagulations. There's also a three-way tap to allow for arterial blood sampling in urgent and emergency testing that as we needed. The second one is also very important. The transducer is intrinsically is it is any device that convert the blood flow into the electrical energies. And how these electrical energies will be presented is going to be through the monitor. So the monitor is basically right now they're gonna display the electrical impulses on a screen on real times. And they also give a digital display of systolic, diastolic, and also mean blood pressures. So with all of that understanding of how the system works in simple terms, let's go on to the procedures. So for the procedures of this ABP monitoring is going to follow a systemic five-step approach. So the first one, in any invasive procedures, we need to understand that to what are the ideal insertion sites. So in step one, the work is to determine the catheter insertion size. So for ABP monitoring, common insertion site usually for brachial artery, brachial, radial, femoral arteries, and to determine whether the artery is applicable for the insertions, an Allen test for collateral supply to the hand via the ulnar artery is also tested. However, also the test sometimes is not infallible, and contraindications of the artery are usually related to infections, any sign of infection, thrombosis, the renal syndrome, or any abnormal vessel anatomy. One note for the radial artery, this is one of the most common site for insertions for the ABP monitoring because of the very low risk of complications and also very easily palpate, usually 1 to 2 centimeters proximal to the wrist. So after we determine the catheter insertion site, we're gonna come to the what type of arterial catheter that we're gonna insert. The first one is the length of the catheter. Usually it depends on the insertion site. For example, in the radial, because the insertion site is very proximal to the skin or superficial, so the length is going to be different than the brachial or femoral insertion site. The second one is the catheter gulf. Usually the 20 Gs is preferred for radio because it's lead under tamping and fewer complications recorded. And the last one, we also need to in charge of, or we need to be cautious of the guide wire technique. Guide wire is basically a system of wire that have to connect or fixate the blood vessel when we trying to do any insertion or catheter insertion inside the vessel. So in the ABP monitoring, usually is the guide wire is used in certain difficult patients, like patient having edema, obesities, or having certain failed attempt before that. So after determine the catheter insertion site, the type of material, then we gonna try to understand how we can fixate this arterial catheter. So first, as following the list of the checklist, so there are certain this is an aseptic procedures. So we need the steroid clubs, the mask, the aseptic, and before we doing the invasions, the skin or the surrounding skin have to be clean or wiped with chlorhexidine. And after that, the catheter and transducer's kit will be established. So the technique of insertions, we have a thing called Salinger technique. It's basically, and Hannah, can you scroll up a little bit,
Okay.
the pictures? Right, thank you. So we have the Salinger technique. It basically is three-step approach. So the first one that the needle gonna insert into the vein, and after that, a guide wire or basically a change of wires gonna following that got basically put inside that needles to go inside the inner of uh the vessel or the vessel, sorry, the vessel, the artery, and it's gonna fixate the locations. And after that, the catheter, the real catheter that's used to lead the blood flow that go inside and lead to the transducer to turn into electrical activities will be established. So it's called a guide wire technique. Sometimes for certain patients with obesity, edema, when it's hard to locate the artery, an ultrasound guide approach can also be implemented. So it can be either static or real time. So static is when we only use ultrasound once to check to confirm the location of the artery, and then we do the insertions, or we do the real time ultrasound. Basically, that we continuously monitor the the insertion process. So this gonna have to improve the success rate. Then, so after the arterial catheter has been established, then we go to modifying the transducer. So in the transducers, there are two steps or two words that we need to be considered. The first one is leveling. So what is leveling? So basically leveling is we gonna set up the transducer positions aligned to the vessel of interest in the same level so that it's not gonna cause any difference in the data that we recorded. Then we have a step called zeroing. It's basically open the stopcock or the valve so that air can flow in. So to activate the zero functions. So basically we need to set up the baseline of the transducer into the zero mark, and then we kind of turn on the machines. And after the transducer have been modified, after the catheter have been fixated, and we got the data on the screen, then we kind of check the BP or blood pressures, waveform quality, and then we can fine tune it or filter certain noise that we consider unimportant. So that on the five-step approach of the invasive arterial blood vessels. So now let's come to certain basics of the interpretation of readings. So first we need to understand what are the common normal values that are presented on the monitor. So because the monitor of the ABP, they usually present three figures. The first one is systolic, diastolic, and the mean arterial pressure. So for systolic, normal range should be around 90 to 140 milligram Hg. Diastolic is 60 to 90, and the mean arterial pressure is the most important, should be around 70 to 100 or 105. But we need to make sure that as a nurse professionals, mean arterial pressure should be above 65 for proper organ perfusions. So as I mentioned, because the monitor also present these number in terms of the wavelength, so we need to also understand some basic uh, interpretation of these figures. So for the normal arterial waveform component, they consist of three parts. The first one is systolic upstroke, or as you can see that the one that they go up very steep. So systolic upstroke indicate a left ventricular ejection. So when the left ventricular they constrict, so blood's gonna flow into the aorta. Then we have the diacritic notch. So represent the aortic bone closer after the ejection step. So the diacritic limb or the downward slope so indicate the diastole. So when the ventricle is refilled with the blood. So this is the normal graph of the waveform of the normal arterial waveform components. So after all of that interpretations, so what are the things that as a nurse when we take care of our patients with ABP should be care of? So next I'm gonna hand over to Hannah.
Okay, thank you so much, Brandon, for your sharing. I think it's very insightful. So now we're going to move on to nursing management. So now all the explanation about how to do the measurement, how to set up everything, what can you do? So first of all, as a nurse, before the insertion, because the insertion is not done by the nurse, it's done by the doctor, but the nurse will work together with the doctor. So what do you do before? So before you have to check the patient history, it's very important. You have to assess if the patient has any bleeding disorder, any anticoagulation, or any vascular condition. Most importantly, we also need to assess the patient for allergies because allergies are very crucial when it comes to surgeries so that there will not be any complication for this patient. You can also assess for the medication that the past medication that the patient has been using before or past surgical history if the patient has had this surgery before or if this patient has had this procedure before or not. You can ask about family history and all that. These are very important for us as nurses to be able to gather all the important information to be able to hand it over to the doctor. The next thing is for us to set up and to flash the system. Now, when it comes to setting up of the atrial line, first of all, you need to prime the tube with heparin or normal saline to be able to prevent coagulation form, as Brandon said earlier, and also to ensure the proper functioning of the system. The next is that we need to perform Allen's test. So with the Allen test, it's to ensure that like there's adequate collateral circulation before radial artery section. This here means that when we perform this test for the patient, it helps the patient's circulation system to be cleared before there's any incision or any injections or any incision being done for the patient. So the next thing during monitoring, that is when it has been injected, what we're supposed to do after that. First of all, we need to make sure that the catheter placement is secured. So in as much as they have been the surgery already, you have to ensure that there is no dislodgement or accidental removal. So we need to educate the patient not trying to remove it by themselves. If they have any discomfort, they need to inform the nurse or the doctor to come and then support them with anything. If they have any discomfort, any irritation at the area of insertion, they need to let us know. So we need to educate the patient as well. And we need to also consciously and constantly monitor to ensure that the vein is secure, the placement is securely done so that we can report for any further assessment to the doctor. Next, we need to maintain a continuous saline flash, which is 3 to 5 ml per hour. This is very important because it helps to prevent coagulation forming or clots forming in the main line. So we always have to make sure that the artery line is not being blocked or clogged with blood clots or any other thing. So we need to always flash it 3 to 5 ml per hour. Next, we need to make sure we check the waveform quality, as Brandon says. So during the procedure, after the procedure, we have to make sure we identify and check the waveform to ensure that if there's any problem or issues like bubble, kink, or maybe any underlying issue regarding the patient's blood pressure and also the entire circulatory system so that we can easily reported to the doctor. The last thing is for us to monitor for any complications for the patient. So we need to check for signs of infection. So signs of infections like if there is redness or if there is any swelling, or we can see if there's any pus or anything that we see that can be as a result of infection for this patient. And also we need to check for bleeding in this patient. And we need to check if the patient has any problem when it comes to lymph perfusion. So maybe we need to assess for sensation, the patient palm or hand, if the patient has any numbness or any tingling sensation or anything like that, so that we can monitor the patient and report to the doctor. So these are the things that we need to do as nurses to manage our patients who are having this procedure. Okay. So I think that will be the end of our presentation today. Brandon, do you have anything else? No? Okay, thank you so much for having us, and we hope to see you next time. Goodbye.